Okay, so now we will cover the nutrition part of family medicine from Toronto Notes. So, for general population, Canada's food guide is appropriate for individuals more than 2 years, because before 2 years, usually the child, the baby is on breastfeed or the formula feed. Council on variety, portion size, and plate layout. Guideline 1 is nutritious food are the foundation for healthy eating. Vegetable, fruits, whole grains, and protein should be consumed regularly. Among protein foods, consume plant based more often, like legumes, nuts, seeds, tofu, fortified soy beverages. Foods with mostly unsaturated fats should be replaced those that contain mostly saturated fats. Water should be the beverage of choice. Nutritious food to consume regularly can be fresh, frozen, canned, or dried. Consider cultural preferences and food tradition. Traditional food improves diet quality among indigenous people. Guideline 2 is processed or prepared foods and beverages that contribute to excess sodium, free sugars, and saturated fats undermine healthy eating and should not be consumed regularly. Guideline 3 is food skills are needed to navigate the complex food environment and support healthy eating. Cooking and food preparation using nutritious food should be prompted. Food labels should be promoted as a tool to help make informed choices. So, basically, what are the things that you're going to tell your patient? To eat healthy, incorporate plant based proteins in their diet, including legumes, seeds, and nuts. And then traditions should be respected. For example, traditional food improve the quality among indigenous people, and excess sodium canned food should be avoided. And food skills are needed to navigate the complex food environment, support healthy eating. Food labels should be read and to make the informed choices. Now, on the right side, we see these boxes. Energy content of the food: carbohydrates has 4 kilocalories per grams, protein has 4 kilocalories per grams, fat has 9 kilocalories per grams, ethanol has 7 kilocalories per grams. Calculating total daily energy expenditure: roughly 35 kilocalories per kg per day, varies by age, height, weight, sex, and activity level. Average calorie consumption should be 2000 to 2100 kilocalories for women and 2700 to 2900 kilocalories per day for men. Handy serving size comparison: 85 grams meat, fish, poultry equals to the palm of your hand, 250 ml dairy, milk, or yogurt size of your fist, and one serving of bread and grains, one slice palm of your hand, 125 grams of rice and pastas, one cup, one hand cup, 250 grams of fruits and vegetables, two cup hand, 28 grams of cheese, full length of your thumb, and then 5 grams of oil and butter is your tip of your thumb. 28 to 57 grams of nuts, chips, and snacks is palms covered. So if you guys are wondering if you need to memorize this, or you need to remember all this information, this is entirely for your for your practice, or maybe you can say for your knowledge. But generally, just have an idea. You don't need to learn them by heart, that how much is a palm of hand of meat, and like that. You don't have to remember the serving size. You just have to have an idea that one thumb is approximately 30 grams of cheese, and then 5 grams of oil is the tip of your thumb. So just an average idea of those things, okay? Otherwise, not to remember each and everything. Now, this picture is a very interesting pictures, and this is exactly from Canada's food guide to 2019. If you open up their website, you will see. Let me just open that up for you as well. So that's Canada food guide. So if you incorporate these websites in your in your study, then you will really enjoy reading Toronto Notes, because this is something that they have. You see, so this is from Canada Food Guide. This is the plate that exactly we have seen in the book as well. So have plenty of vegetables and fruits, eat protein foods, make water the drink of choice, and choose whole grains. So this is exactly what we were reading in the book, if you remember, right? Water is the choice of beverage, grains, uh, plenty of fruits, whole grains. Now let's see next. So enjoy your food. And so if you go through when you're free, you make sure you go through these you know let's see the food labels. You go through these website, you will enjoy reading them, and I'm sure you might find something more interesting, right? And if you see tips for healthy eating, storing food, vegetables, so that's how you can make your study interesting, right? Going back, so this is the plate that we have seen already. Eating plenty of fruits of all colors, use healthy oils, olive oil, canola oil, limit butter, avoid trans fat, eat plenty of variety of vegetables, Variety of whole grains, limit refined grains, drink water, tea, or coffee, limit milk and juice, 1 or 2 servings per day, avoid sugary drinks, and healthy eating proteins, fish, poultry, beans, nuts, limit red meat, processed meat, and cheese. Okay, so now on the right side is a box. This is Osteoporosis Canada recommendations for calcium and vitamin D requirements. So vitamin D 400 to 1000 IU for individuals 19 to 50 years, 800 to 2000 for individuals more than 50 years and younger adults at high risk of osteoporosis, multiple fractures, inadequate vitamin D absorption. So this is the recommended dose for individuals more than 50, 800 to 2000, and 19 to 50 is 400 to 1000. Calcium 1000 milligram daily for from all sources for individuals from 15 to 19 to 50 years and pregnant and lactating women, and 1200 milligrams for individuals more than 50. Recommended to obtain calcium from diet whenever possible. So on average you can make an estimate that for people with more than 50 years of age, they recommend more vitamin D and more calcium. More calcium means 1000 is for average population, you would do 1200 milligrams for more than 50, and if it's 1000 for average population for vitamin D, you would do 2000 for more than 50 patients. Okay, now cardiovascular disease prevention, dietary guidelines for reducing risk of cardiovascular disease. Carbs. Complex carbs, legumes, whole grains should be favored over simple carbs like white flour, rice, or table sugars. Eliminate sugar sweetened beverage in favor of water. Vegetables, fruits and vegetables, consume high portion of whole fresh fruits and vegetables. Consume leafy green vegetables and berries at least 3 times a week. Consume starchy vegetables, white potatoes, corns, green peas in moderation. Fats, consume mono and polyunsaturated fats in moderation. Non-tropical vegetable fats, liquid fats. Minimize trans fats intake like processed and snack foods. Limit saturated fats, processed food, red meat, cheese, whole grains, butter. Olive oil and canola are recommended over butter, margarine, and coconut oil. Skim or 1% milk is recommended over whole milk. So on average you'll enjoy reading all these recommendations because you'll get to learn for your own self as well. So yeah, there's no rocket science in nutritional part of family medicine. Protein, consume fish with higher levels of omega-3 fatty acids, salmon, tuna, mackerel. Moderate consumption of lean poultry, seafood, and nuts. Limit red meat. Minimize consumption of processed meat, deli, cold cuts, sausage, bacon. Salt is less than 2000 milligrams per day. Alcohol is less than 3 drinks per day on most days for men, and maximum 15 per week, and less than 2 drinks per day on most days for women, maximum 10 per week. Alcohol is the most important part in this entire table till now. Okay, so make sure you need to know why, because of various reasons. Number one is alcohol use disorder is number one reason that you need to know why. Because if the patient is taking more than 3 drinks per day, or maybe taking more than 15 drinks per week, that means the patient is having alcohol addiction. Then if the woman is taking more than 2 drinks per day or more than 10 per week, so that is again a red flag. So you need to learn all these things. Okay, so this is important for your QE1 questions. Mediterranean diet. So there are different diets that are available out there. One is Mediterranean diet, which has high intake of leafy green vegetables, fruits, whole grains, nuts, legumes, extra veg and olive oil. Moderate intake of fish, lean meat, low fat dairy, poultry. Low intake of red meats and sweets. If choosing to consume alcohol, low risk drinking guidelines suggest limit 3 drinks per day for men and 2 drinks per day for women. So you need to remember that number for drinks. And then the Mediterranean diet has like green vegetables and leafy green vegetables, fruits, and more of protein, less fat. Now, dash diet is very common diet. Make sure you remember this one for high blood pressure, because this is a very commonly asked or very commonly discussed diet in the questions. High in vegetable, fruits, no or low fat dairy, whole grains, poultry, fish, beans, seeds, and nuts. Low in sodium, sweets and added sugars, and sugar sweetened beverages, fats, and red meat. Low in saturated fats, trans fats, and cholesterol. And high in potassium, magnesium, calcium, and protein and fiber. So this is the dash diet that is usually prescribed for patients with high blood pressure. Okay, so vegetarian diet, substitute meat, seafood, poultry with soybean products, legumes, and nuts, and whole grains. So these are right below. They have written abbreviation for dash diet, which is dietary approach to stop high blood pressure, which is hypertension. So yeah, so that's about it from on the nutrition aspect of family medicine. Now next we will cover this obesity. Okay, so thank you for watching this video, and keep on following the videos ahead so that you can keep a good track of all the family medicine chapters. So we will cover objective wise each objective of this chapter, just so you can easily learn family medicine from Toronto Notes. Thank you for watching this video, and make sure you subscribe to my channel. Thank you.